Welcome to The Explainer. Today, we're digging into a study that puts a specific hands-on physiotherapy technique to the test, all for one of the most common and, let's be honest, annoying elbow injuries out there. So, here's how we're going to break it down. First, we'll get a handle on the problem itself. Then, we'll look at this new technique they're proposing. After that, we'll see how they actually designed the experiment, dive into the results, and finally, wrap up with what this all means for physios in the real world. Okay, first things first. Let's really understand the clinical problem that this whole study is trying to solve. This is a question that comes up in clinics constantly. The fancy name is lateral epicondylitis, but you probably know it as tennis elbow. It's basically a repetitive strain injury that causes that sharp, nagging pain on the outside of your elbow, especially when you try to grip something. You know the one. And this isn't some rare, obscure condition. We're talking about up to 3% of the entire population dealing with this. That's a lot of people, which makes finding a really effective treatment a pretty big deal. All right, so what do we do about it? Traditional treatments work, sometimes, but they don't always hit the mark, which is why researchers are always on the hunt for something better.
And that brings us to this technique, Mulligan Mobilisation with Movement, or MWM. It's a hands-on approach developed by a physio named Brian Mulligan. The whole idea is that maybe there's a tiny positional fault in the joint, and this technique aims to correct it by applying a specific glide while the patient is actually moving their arm.
And this quote really hits the nail on the head. It's saying that a lot of our standard treatments are great for managing symptoms, but they might not be doing much to actually heal the tissue. That's the gap that something like MWM is trying to fill. Okay, so you've got this promising new technique. How do you actually prove it works? For any of you studying physiotherapy, this is where it gets really interesting. The design of the experiment is everything. So the core question is pretty simple. They're not trying to replace standard physio. They're asking, if we add this Mulligan technique on top of everything else, do patients get better results? And here's how they set it up. It's a really clean and classic design. They took 34 patients and split them into two groups. Everybody got the usual treatment, heat, massage, exercises. But only one group, the experimental group, also got the Mulligan MWM technique. This is so important because it lets them isolate the effect of that one single addition. So what does this technique actually look like? Well, it's pretty straightforward. The therapist holds the upper arm steady and applies a very specific sideways glide to the forearm. While that glide is held, the patient just makes a fist. They repeat this over and over. It's a combination of a passive force from the therapist and an active movement from the patient. But how do you measure if it's working? You can't just ask, hey, do you feel better? You need hard data. So the researchers tracked 3 key things before and after the 4-week treatment period: pain level, how much the elbow interfered with daily life, and of course, raw grip strength. Okay, that's the setup. Now for the exciting part, the results. After all those treatment sessions, what did the numbers actually say? Did this fancy new technique make a difference? Let's find out. All right, I know a table full of numbers can look a little intimidating, but don't worry. Just focus your eyes on that last column, the one labeled change. That's the whole story right there. It shows us exactly how much each group improved from start to finish. And the first big finding is, standard physiotherapy works. Surprise! Both groups got better. And when we say statistically significant, that's just the researchers' way of saying the improvement was big enough that it's almost certainly not a fluke. So, that's great news for standard practice. But here's the million-dollar question. Was it just another treatment option, or was it actually better? This is exactly why you have a control group in the first place, to answer this very question. And bam! The answer is a pretty clear yes. Just look at those bars. The experimental group, the one that got the Mulligan technique, had way bigger improvements in both pain reduction and daily function. It's not even close. The data here is speaking loud and clear. Now, it's really important to be precise here. When it came to grip strength, things were a little different. While the Mulligan group did improve and the control group actually got a tiny bit worse, the gap between them wasn't big enough to be statistically significant. The trend was there, for sure, but it didn't quite cross that scientific finish line. So, let's bring it all home. If you're a physio, or you're studying to be one, what do you do with this information? How does this study actually translate into what you do in the clinic on a Monday morning? Well, the study's conclusion doesn't mince words. When it comes to the things patients care about most, their pain and their ability to just live their lives, adding the Mulligan technique seems to get them better faster. But hold on, before we all run out and start using this on every patient, it's crucial to think critically. Being a good clinician means looking at the limitations. This wasn't a fully randomized trial, and the number of patients was pretty small. So while these results are super promising, it's just one piece of a much larger evidence puzzle. And that really is the final question, isn't it? This study gives us a pretty compelling reason to at least consider adding this technique to our toolkit, especially for those patients who are really struggling with pain. It's a low-risk, hands-on option that just might speed up their recovery. So what do you think? Is it something you'd try?